The topic for this presentation is optic nerve. We'll be discussing anatomy and signs of optic nerve dysfunction. Starting with anatomy, we'll start with general structure. The afferent fibers. The optic nerve carries approximately 1.2 million afferent fibers, each of which originates in the retinal ganglionic cells. Now, these fibers, they synapse in the lateral geniculate body, although some reach other centers, notably the pretactile nuclei in the midbrain. After that, nearly 1/3 of the fibers subserve in the central 5 degrees of visual field. Within the optic nerve itself, the nerve fibers are divided into about 600 bundles by the fibrous septa derived from pia mater. Now the surrounding layers. The innermost layer is the delicate vascular pia mater. As you can see in this figure, the P, which is denoted by an arrow, it signifies pia mater, the innermost layer. The outer sheath comprises the arachnoid matter, as A denotes here in this picture is for arachnoid matter, the histological picture. This is the A. And the tougher dura matter, which is denoted by the D. And dura matter is continuous with the sclera. Now, here in the similar picture, this arrow here, LC denotes lamina cribrosa, and arrow points to the fibrous septum. And again, this is a picture which denotes the pia mater, the blood vessels in the pia mater, arachnoid, and the dura mater. Optic nerve fenestration involves incision of this outer sheath. The subarachnoid space is continuous with the cerebral subarachnoid space and contains CSF. Now, anatomical subdivisions. The optic nerve is approximately 50 millimeters long from the globe to the chiasm. It can be subdivided into 4 septums or 4 segments. So the first segment is the intraocular segment, which is 1 millimeter deep. It is the shortest, and it is also 1 millimeter deep and approximately 1.5 millimeter in vertical diameter. The ophthalmoscopically visible portion and is called optic disc as well. The second part is the intraorbital segment. Now this is 25 to 30 millimeters long. This is the longest part here and extends from the globe to the optic foramen at the orbital apex. Its diameter is about 3 to 4 millimeters because of the addition of the myelin sheath to the nerve fibers. At the orbital apex, the nerve is surrounded by tough fibrous annulus of Zinn, from which originates the 4 recti. Then is the intracanalicular segment, which traverses the optic canal and measures about 6 millimeters. Unlike the intraorbital portion, it is fixed to the canal since the dura mater fuses with the periosteum. Then, in the end, is the intracranial segment, which joins the chiasm and varies in length from 5 to 16 millimeters and averages about 10 millimeters. Long intracranial segments are particularly vulnerable to damage by adjacent lesions such as pituitary adenoma and aneurysms. Now this picture here shows the intraocular segments, also called optic disc, and it is the clinical appearance when we see it with the ophthalmoscope. Now, discussing the signs of optic nerve dysfunction, the first one is reduced visual acuity for distance and near. That is the most common sign, but it is non-specific. Acuity may be preserved in some conditions. Then is the relative afferent pupillary defect. After that is dyschromatopia, which is impairment of color vision, that in the context of optic nerve disease mainly affects red and green. A simple way of detecting a monocular color vision defect is to ask the patient to compare the color of red object using each eye in turn, or to undertake an Ishihara test. Then is the diminished light brightness sensitivity. Afterwards, diminished contrast sensitivity, and then visual field effects. Now these are the 6 signs of the optic nerve dysfunction. Visual field effects which vary with the underlying pathology include diffuse depression of central visual fields, central scotoma, centrocecal scotomas, nerve fiber bundle, and altitudinal. One thing that should be kept in mind is the diminished light brightness sensitivity persists after the visual acuity returns to normal in most of the cases, for instance following the acute stage of optic neuritis. And also loss of red-green color vision is a common manifestation of optic nerve disease and can be rapidly tested with Ishihara test, although there are exception to the rule. For example, in glaucomatous disc damage, red-green colored dyschromatopsia is not common. Now, focal visual field effects in optic neuropathies include central scotoma, which occurs in demyelination, toxic and nutritional optic neuropathies, Leber hereditary optic neuropathies, and optic discompression. Enlarged blind spot occur in papilledema and congenital anomalies. Then respecting horizontal meridian occurs in anterior ischemic optic neuropathy, glaucoma and disc drusen. Upper temporal defects which do not respond to vertical meridian occurs in tilted disc. And lastly, classification of optic neuropathy by cause. Inflammatory optic neuropathy occurs in optic neuritis, including demyelination, parainfectious, infectious, and non-infectious, and neuroretinitis. Then is the glaucomatous. Afterwards, the third cause is ischemic, which occurs in anterior non-arthritic and anterior arthritic, posterior ischemic and diabetic papillopathy. Then number 4 is hereditary, which occurs in Leber hereditary optic neuropathy and other hereditary optic neuropathy. Number 5 is nutritional and toxic. Number 6 is papilledema, which occurs secondary to raised intracranial pressure. Then number 7 is traumatic. Number 8 is compressive, which including secondary to an orbital lesion. And finally, number 9 is infiltrative, which occurs in inflammatory conditions, for example, sarcoidosis, tumor, and infective agents. So that's it with this presentation. If you like it, please press on the like button and subscribe to the channel. Thank you.